Hi guys, it's Pierre, the physical therapist, and today we're talking about periscapular pain. A lot of times, periscapular pain can be referred from the cervical spine. So we're going to do a good job of checking the cervical spine, making sure that that's not the source of the issue. But let's go ahead and say, for example, we've checked the cervical spine and that's not the issue. What are we going to do physical therapy wise to try to address those symptoms? First thing we're going to do is we're going to talk about postural things. Are you in postures that are putting your head forward or rounded shoulders? So we're going to talk about how you can modify your posture, not to, over exaggerate correcting it, but just to kind of put you in a better position to work smarter and work easier. The next thing we're going to do is we're going to check and see is there any tight tissues or trigger points that we can address. So sometimes we might have you put some pressure on that trigger point and laterally flex or flex away from it to put that muscle on stretch. If you're really super in a lot of pain, we might actually put some pressure on that spot, that trigger point, and have you put that muscle in a shortened position. So a strain, counter strain versus a release position. We're also going to look at how is your scapula moving. Sometimes if you don't have good scapulothoracic movement, we might do a mobilization with movement where we have you elevate your arm and move that scapula with that elevation to try to get movement there. Further down the road, we'll work on stability. I know I just said that we want your scapula to move properly, but we also want it to be a source of stability when you're transferring forces from your arm to your axial skeleton. So there's a lot of things we can do to treat that periscapular pain. It's a very common condition and one that's really easily treatable. I encourage you to come in and so we can come and take a look at you and learn more about what's going on with you so we can help you move better and feel better and live better. Thank you.